Hello, welcome back to my channel, lovely people. Thank you for tuning in today. And for my new subscribers, thank you, thank you, thank you. Today we'll be talking about contraceptives. What are contraceptives? Contraceptive is a name given to medicine and other devices used to prevent pregnancy. Contraceptives is not just only to prevent pregnancy. There are other uses for contraceptives, like the prevention of painful menstruation. Use contraceptive to regulate your period. In our last episode, we talked about PMS and PMD, and we talked about how some of the contraceptives are used to help to treat people that are actually suffering from PMDD and PMS. Contraceptives can be used to reduce the symptoms of endometriosis. Contraceptives can also be used to reduce polycystic ovarian syndrome. So as we can see, there are a few reasons why contraceptives are used. It's not just only to prevent pregnancies. There are 5 types of contraceptive. The first one is long-acting reversible contraceptive. The second one is hormonal contraceptive. Third one is emergency contraceptive. The fourth one is a barrier method. And the fifth one is permanent contraceptive. So for today's episode, we'll be concentrating on the long-acting reversible contraceptive and the hormonal contraceptive. Long-acting reversible contraceptive, like the name goes, is a contraceptive that can last up to 10 years in the woman's body. It is a long time and is reversible. The second one, the hormonal contraceptive, consists of one or more synthetic female hormone in them. So these two we're going to talk about. Long-acting reversible contraceptive comes in different forms. They can come in the form of injection and come in form of implants in the body, be like a device that is planted in the woman's womb or in the woman's uterus. Now, the hormonal contraceptives are the contraceptive that gives out hormones. Long-acting reversible contraceptives, for example, the injection. This injection is given every 3 months in your bottom. It depends on the type of contraception that you want. I just want to make clear, I am not a doctor. What I talk about here is what I've read up on, and some of them I have used as a woman. But I tend to share with all of you out there so that somebody who needs this information will make an informed decision. But before you make any informed decision regarding contraceptive, please speak to your doctor. Especially the hormonal contraception are not okay with some women having a hormonal problem. You need to speak to your doctor. You and your doctor will look into your case, because every woman's case is different. They will look particularly into your case and they will decide which contraception suits you best. So the injection is taken every 3 months. And this injection will help in preventing pregnancy. The next one is the IUD, which is the intrauterine contraception. And this one is popularly known as the coil. Most women are aware of it. The good thing about this one is that it can last in your body up to 10 years. So you can use it, and the essence of it is also to prevent pregnancy. But speak to your doctor will know which suits you best. For me, I decided to go for the implant. It's normally on your upper arm. So they put it here, and what it does is that it releases the hormone progesterone. Even though that something is there, like a tiny rod. Once it's done, it's there. This one normally lasts 3 years. So the doctor or the nurse that will do it will give you like a card, and they'll put the dates there so that they'll remember when it's done and the day it needs to be taken out. Within that 3 years, within the 5 years, you can decide that you want it out. When I knew I was ready for my second child, I went and I took it out. So that's why these contraceptives are called reversible contraception, because you are in control. You can say, I no longer want it. You can say, okay, I want to have it up till this time. That's one of the advantages. Instead of you deciding, okay, I don't want children, I want to take my womb or everything out, you can be on this contraception so that if you change your mind in the future, you can come back to it. If you decide, oh, okay, I've changed my mind, I want to have more babies, it's reversible. They can take it out. The IUD can be taken out. The implant can be taken out. The injection, you can stop taking them, so you can still have a baby. So that is one good advantage. But the disadvantage is that all these things, they require procedure. The one in my arm, it doesn't take time, to be honest. It didn't even take the lady. I wasn't under any anesthetic. There was no painkiller. She just did it. She asked me. She just did it within, it's not up to 10 minutes. She just did it and it was there. I could feel it, each time I touch it, I can feel it. I've not done the intrauterine one, so the coil, I've not done that. I don't have any idea how that works. I don't know how long that takes. So, but it's something that if you're willing to do that, because that lasts quite long, you can speak to your GP, you can speak to your doctor, and both of you will decide which bed suits you. Like I said, I prefer the one on my arm because I don't feel comfortable, them putting anything inside of me. That's why. So that said, speak to your doctor, speak to your GP. They will know the best that suits you. And more importantly, they've got to make sure that whichever one that will be put, or whichever contraception you be given to, will have to be in sync with your body, because our body, the women body, our body is already filled with hormones. So you don't want the one that might now want to counteract your hormone already in your system. So thank you for watching today. In our next episode, we have to carry on to look at the barrier method, emergency contraceptive, and the permanent